Hi, everyone. Thanks for joining. We're going to go ahead and get started in just a minute here. All right, I think we can go ahead and get started. Hopefully more folks trickle in. So let's get going. So hello and welcome everyone to today's event, Standing Together to Address Urban Indian STI Disparities, Partnership Opportunities for UIOs. I'm Sophie Chishty, and I am a Public Health Associate at the National Council of Urban Indian Health, also known as NCUIH. Next slide, please. Today's event will be recorded and shared on NCUIH's YouTube channel. We hope that you all turn on your video to help us to better engage with you and that you mute yourself when you are not speaking. We also ask for your name, organization, and any tribal affiliations in the Zoom chat. Next slide, please. For today's agenda, after these introductions, we will have a brief review of STI disparities provided by the CDC. Then we will provide an overview of opportunities for UIOs, go through an activity, and have an open discussion before bringing today's event to a close. Our objectives for today's event include to increase knowledge of STI disparities that impact American Indian and Alaska Native persons, to increase awareness of and interest in opportunities for UIOs related to STIs, and gain insight into the barriers and challenges related to STI care. You will also see the QR code for a survey to provide feedback on today's event on many of today's slides. Survey respondents will also have the opportunity to enter a raffle to win a prize from NCUIH, so please provide your feedback. Next slide. So to provide a little background on us, the National Council of Urban Indian Health, also known as NCUIH, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is the only national representative of the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service and the Indian Healthcare Improvement Act. NCUIH strives to improve the health of the over 70% of the American Indian and Alaska Native urban areas, as supported by quality healthcare centers. Next slide, please. We also want to take a moment to acknowledge that NCUIH is proud to partner with the U.S. Centers for Disease Control and Prevention through our cooperative agreement, CK20-2003. The CDC is an agency within the Department of Health and Human Services, and the contents of this program do not necessarily represent the policies of CDC or HHS and should not be considered an endorsement by the federal government. Here you can see our team for this project, including our presenters for today, which includes myself and Mattie Curry, our Public Health Program Manager. We are very grateful for our wonderful team. And now I will hand the floor over to today's presenter from the CDC, Rachel. Thank you. Oh, Rachel, I think you're on mute, so we can't hear you.
Oh, thank you so much. Thank you. I have too many buttons I'm trying to push right now. Thank you, Sophie, and thank you to NCUIH for inviting us to join today. And before I start talking about STIs, I would like to quickly introduce the CDC team who will be working with NCUIH on this project. Next slide, please. So I'm Rachel Kachur, and I will serve as the CDC technical monitor on this project. And I'm a health scientist, and I sit within the Division of STD Prevention at the CDC, where I've worked for over 20 years. My colleague, Melissa Habel, who you see on the screen here, is not able to join us today, but she also works within the Division of STD Prevention, and she sits in our Policy and Partnerships office. Missing from this slide, but who is joining us on the call today is Anna Madsen, and she is a fellow in our division and will be helping out with this project. We also have Lavinia Nicole, a behavioral scientist in the Division of STD Prevention. And then lastly, joining the team and with us today is Dr. Melanie Taylor. Melanie is a clinician and a medical officer based in Maricopa County in Phoenix, and she currently works in the Division of HIV Prevention, but prior to moving to the Division of HIV Prevention, she worked with us in the Division of STD Prevention, and she oversaw our partnerships with IHS and many of our American Indian Alaska Native projects. Next slide, please. So as many of you are likely aware, STDs remain a significant public health concern in the United States. And even in the face of COVID, 2.4 million cases of STDs were reported in 2020, which is the last date of our available surveillance data. And the syphilis epidemic continues to surge, driving another year of increases in congenital syphilis, with jurisdictions reporting more than 2,100 cases of congenital syphilis, which is an increase of 15% since 2019 and a 235% increase since 2016. Gonorrhea and secondary and primary syphilis continue to increase by 10 and 7% from 2019 and 2020, with a little bit of a silver lining with chlamydia declining in 13% in 2020. Next slide. And it goes without saying that left untreated STDs can cause significant morbidity, increasing one's risk of acquiring or transmitting HIV, causing long-term PID, and it can affect pregnancies, both the ability to get pregnant as well as creating pregnancy complications. So I'm now going to show you some rates of reportable STDs, but I do want to note that COVID significantly affected our STD surveillance and prevention efforts and continues to affect trends in diagnosed and reported STDs. So the trends coming out of CDC and our surveillance data have to be interpreted with that context. Next slide. So the next couple slides you're going to see a theme. It's going to be repetitive, and I'll move through them quickly. What I'm showing you here are rates of cases reported out by race, ethnicity, and gender. And what you can see is that non-Hispanic American Indian or Alaskan Native women and non-Hispanic American Indian and Alaska Native men have the second highest rates of reported chlamydia. Next slide. And we see similar findings for gonorrhea, again, with American Indian and Alaska Native men and women having the second highest rates of reported gonorrhea behind African American men and women. Next slide. We start to see a slight shift when we look at syphilis numbers. And in our 2020 data, again, American Indian and Alaska Native men have the second highest rates of syphilis, but among women, we see that Alaskan Native and American Indian women have the highest rates of reported cases of primary and secondary syphilis. And these rates have been on the rise since 2015. And so when we see rises in syphilis, we'll also see rises in congenital syphilis. Next slide, please. So it's not surprising, again, that we are seeing these high rates of congenital syphilis, and they're highest among American Indian and Alaska Native populations. And in fact, even though the AI-AN community represents 1% of live births, they are representing 4% of congenital syphilis cases. And we know that the arrival of COVID-19 led to an extensive social disruption within many communities, including tribal communities, that further fueled these STD morbidities. Next slide, please. What I didn't cover in those past slides, but it's worth mentioning, are these rates also shift and become a little more concentrated when you add in additional demographics like age and sexual orientation. So you might see within syphilis, we're seeing higher rates among men who have sex with men. We also see those high rates of STDs among the younger populations of that 15 to 24. But two of our main goals within our division of STD prevention are, one, just to reduce STIs in general across the board, but also to reduce STI-related disparities and health inequities. And that was the impetus for this project. And so before I pass the slides back over to NCUIH, I did want to mention a few areas where our division continues to work with American Indian and Alaska Native communities. Most recently, we have been doing a lot of work providing assistance around outbreak responses, whether it's like a jump in STD cases or an actual outbreak. And our most recent response was with the Navajo Nation last year and with the syphilis outbreak. And we provided some technical assistance around things like program assessments, helping to build partner service capacity, and providing epi and clinical support. We also work to provide a lot of clinical trainings and education, and we do this in a variety of ways, two of which I've listed here. One is through our ECHO program, where our clinics are paired together to help jointly manage cases, particularly cases of things like syphilis that are seen in rural or underserved, under-resourced clinics. And then our prevention training centers have created and offer targeted STI trainings to clinics on tribal lands or in those clinics that have high proportions of AI and AN clients. We also work with IHS on our surveillance report and on a surveillance report specific to American Indian and Alaska Native populations. And this includes working on data collection, developing a collaborative report, and doing some technological things like creating code, like writing code to help improve their surveillance activities. And then lastly, as I mentioned at the start of this slide, we do fund these demonstration projects where we are trying to improve STI and sexual health services outside of traditional STD clinics. And so we are trying to expand our STI services into areas like pharmacies and retail health clinics and onto college campuses, as well as urban Indian organizations that provide clinical services. So that's what was the impetus for this project. And we are so excited and thrilled to be partnering with NCUIH on this. And I'm just going to stop here now, and I can take any questions if we're doing questions. And I think we should have our, yes, in the slides above, we have our contact information if you have questions after this webinar. Thanks.
Thank you for that amazing lecture, Rachel. We really appreciate it. If anyone has any questions, we'll take a moment to pause here, and you can feel free to unmute yourself and ask them aloud or type them in the Zoom chat.
And if questions come up later and again after this webinar, either myself or any of my colleagues are happy to answer.
Okay, great. Thank you so much, Rachel and Sophie, for starting us off for a great webinar. And hello, everyone. My name is Mattie Curry. I am a member of the Blackfeet Nation and a public health program manager at NCUIH. And now I would like to discuss some of the opportunities that we have at NCUIH for UIOs. Next slide, please. So to provide some background on this new project at NCUIH, this is the first year of a 4-year project focused on improving STI clinic services to American Indians and Alaska Natives through partnerships. Some of the intended outcomes for this project include developing and implementing trainings on STI services to UIOs, increasing capacity, skills, and knowledge at UIO-related STI services, improving access and quality related to urban Indian STI care, and ultimately reducing STI disparities for AIAN persons. Next slide. We are excited to announce that we have a partnership opportunity for UIOs that we are recruiting for, which is called Partners Against Urban Indian STI Disparities. If you are interested in developing and/or enhancing your current STI services, we would like to work with your organization to identify and address gaps and barriers related to your STI services in order to ultimately reduce urban Indian STI disparities. We are recruiting up to 2 UIOs for this opportunity, and all UIOs are welcome to apply. From this opportunity, UIOs will gain collaborative partnerships with NCUIH, the CDC, and other UIOs. You can also receive support in identifying and addressing gaps and barriers in STI services, improve your understanding of STI disparities that affect AIAN persons, and become more aware of resources and strategies. Selected UIOs will have the interest and capacity to collaborate to identify and address STI service gaps and barriers, including attendance at NCUIH's STI trainings in April and August, and attendance at monthly calls with our team. Only those who submit completed applications will be considered, and preference might be given to UIOs who already currently offer some form of STD or STI services. Next slide. So the 2 selected UIOs will each receive $7,125 for their participation, although we will actually likely be increasing this funding amount. Applications are due by February 17th, and final selections will be communicated by March 1st. Selected UIOs will participate until the end of September, with participation beginning as early as March. There may also be a possibility to continue this partnership throughout the next grant year. If you have any questions about this opportunity, you can email me using the email you see here. My email and the application link will also be shared now in the chat, as well as after this event via email to you all. I see Zoe put that in there, so thank you so much. Okay, next slide, please. So we are also developing an STI questionnaire to collect information from UIOs about current services related to STDs and STIs, barriers and challenges to STI care, interest in developing and enhancing STI services, and more. So please keep an eye out for updates from our team about participating in this survey opportunity. Next slide. We will also be hosting 2 more events as part of our Standing Together to Address Urban Indian STI Disparities series later this year. These community of learning sessions will be live virtual training events that will take place via Zoom on April 6th and August 2nd at 2 p.m. EST. And these will be open for anyone to attend. We hope to use these events to hear more from UIOs about their experiences with STI service provision, provide training to improve knowledge, skills, and capacities related to STI care, and to help foster collaborations and establish partnerships to ultimately reduce STI disparities. We hope to see you all there, so please keep an eye out for future communications from NCUIH about these events. Next slide. We'd also want to remind you all of NCUIH's technical assistance services. You can request one-on-one technical assistance from NCUIH to support you in areas like training, research, evaluation, program planning and implementation, and more. To request technical assistance, please visit ncuih.org/TA/one-on-one. This link will also be shared in the chat. Thanks, Zoe. Alrighty, so next slide, please. So we'll now pause here to see if you have any questions about these opportunities before we continue. Please feel free to unmute yourself or type in the chat to ask any questions.
And I see a question in the chat of, will we receive a copy of these slides? These slides will be shared via email to all event registrants and attendees after today's event.
Thank you, Sophie. Okay. Again, if anyone has any questions as we move through, please feel free to drop them in the chat or contact us after the event concludes. Thank you. So now we are going to move on to an activity. I believe we're going to do a screen share switch. Great, looks good, Sophie. Thank you. So now we'll be going through an activity to hear from all of you about your experiences and perspectives on STI care. Next slide. So for today's activity, we are going to use Poll Everywhere. You can participate by using an internet browser on any device or by texting in your responses. You can visit pollev.com/wiredsun334 to join through your browser, or you can text wiredsun334 to 22333. You can also scan this QR code to join the poll. These instructions will also be in the Zoom chat and on each slide. All responses are completely anonymous, so if you are prompted to provide a name for the activity, you should be able to skip it, but either way, no users will be identified throughout this activity. You can also feel free to share any additional thoughts, comments, or questions by unmuting yourself or sharing in the Zoom chat if you would like. Next slide. So we'll give everyone a second to join. And please unmute yourself or pop it in the chat if you're having issues joining. But we'll start with this first question. Does your UIO currently offer any services related to STDs or STIs? You can respond yes, no, not sure. Please keep in mind that you can only respond once and you can't change your answer.
And Mattie, I think I see you speaking, but I can't hear you, so I think you're muted.
Sorry, I was trying to find my spot. My script just went away, but it's all we're back. So okay, that seems like we got some answers. So we'll move on to the next question. Next slide, Sophie. Here. Next, is your UIO interested in developing in or enhancing its services related to STDs or STIs? This can be your best guess from what you know about your organization's current plans and capacities. You can respond yes, no, not sure. Again, please keep in mind that you can only respond once and can't change your answer. And Sophie, I'm not sure if you can see the count. And to let me know when answers are starting to slow down, but it looks like the majority of people answered yes, so that is good. Okay, I guess we'll move on to the next question. Next slide. So which of the following would your organization be most interested in developing or enhancing? You can please keep in mind that you can only respond once and you can't change your answer. So the response options for this question include data collection of sexual history information from patients, data organization and reporting, referrals for STD, STI services and resources, screenings for STDs and STIs, screenings for conditions related to STDs and STIs, STD and STI related partner services, STD, STI related prevention services and resources, and treatment for STDs and STIs. If there are also any other aspects of any STI services that come to mind that your organization would be interested in developing or enhancing, please feel free to share those in the Zoom chat or to mute yourself to share out loud. Unmute yourself, excuse me. Okay, so it looks like a lot of majorities referrals for STD and STI services. 100% for that one. STI-related prevention services and resources. So it's about 50-50 between referrals and providing prevention services. See if any other responses come through. Okay. The answers are slowing down a little bit. So we'll move on to the next slide. Okay, so the next question is, from your perspective, what is the greatest barrier or challenge to providing STD and STI care? Again, please keep in mind that you can only respond once and that you can't change your answer. Response options include inadequate resources and available staff for staff trainings. Oh, wait, are we? Okay. Insufficient funding. Wait, Sophie, are we on the right one or am I skipping? Oh, I'm sorry, Sophie, I was looking at the wrong one. So from your perspective, what's the greatest barrier and challenge to STD and STI care that your patients and clients experience? Please keep in mind, again, you can only respond once and you can't change your answer. The response options include concerns of confidentiality or privacy, costs of care, delays in receiving timely care, distance from care, or stigmas related to STDs and STIs. Again, if there's any additional barriers or challenges, please feel free to share those in the chat or unmute yourself. Seems like most of the responses are around stigmas related to STDs and STIs. Okay. I'm not sure if any other answers are trickling in, but it looks like the majority stated that stigmas related to STDs and STIs are the greatest barrier and challenge for patients. Okay, next question then. Okay, this is so again, from your perspective, what is the greatest barrier and challenge to providing STI care? Please keep in mind that you can only respond once and that you can't change your answer. Response options include inadequate resources available for staff trainings related to STDs and STIs, insufficient funding for sexual health tools, resources and/or programs, insufficient staffing, insufficient tools and resources related to screening or testing for STDs and STIs, or insufficient tools and resources related to treatment of STDs and STIs. If there's any other additional barriers or challenges that come to mind, please drop them in the chat or unmute yourself. And we'll wait for answers to roll in. Insufficient staffing. That seems to be a big one. Again, we really appreciate your participation in this. Okay, so it looks like the majority of respondents replied, or 100% of the respondents replied insufficient staffing as the greatest barrier or challenge to providing STI, STD, and STI care. Okay, so we'll move on to the next slide. Okay, so this will be in a free response, open-ended response. Please describe any additional barriers or challenges to STI care that you have witnessed or experienced at your UIO. This can be from either the patient or provider perspective. Again, this is an open-ended question, so you can type out your response and it'll appear on screen. You can also respond more than once, and you can feel free to share out loud in the Zoom or out loud or in the Zoom chat if you prefer. Again, any additional barriers or challenges that you might have witnessed or experienced for STI care. Again, and then Sophie dropped in the chat that if you have any trouble coming up with any additional barriers or challenges, you can also elaborate on some of the barriers and challenges that we've already discussed in previous questions, like stigmas around STIs, staffing capacity, etc. And then if you are also having trouble with the survey website, please let us know. And then Sophie also just noted that for those of you who might have joined who missed the instructions around this activity, please follow those instructions that she dropped in the chat. Okay, and if you don't feel comfortable sharing, that's fine. If you would like to reach out to either myself or anyone else on the project team, please feel free to contact me and share your experiences or any sort of barriers or challenges or protective factors that might be in place for providing STI care at your UIO. Okay, so we'll move on to the next slide. And this will be our last question. Finally, is there anything that you would like to see in future NCUIH trainings related to STDs or STIs? Again, this is an open-ended question, so you can type out your response and it will appear on the screen. And you can also respond more than once, and you can feel free to share out loud or in the Zoom chat if you prefer to. This could be a specific topic, skill, or any other aspect of STIs and STDs. Oh, that's nice. And these suggestions could also help inform for our community of learning events that we have coming up for this year. So Resources. Okay. Oh, this is a great one. Cameron in the chat wrote, sharing success stories from those who have seen good use of STD and STI testing services. Yes, it's great to have those examples. Oh, communication tools. That's a great one too. Yes, very necessary for providing services. Again, if you have any suggestions that you would just like to share directly with me, please feel free to reach out to me at mcurry@ncui.org. I'd be happy to chat and discuss any other additional topics for NCUI trainings related to STDs and STIs. Yeah. Okay, so if there's no other responses, we will close this activity. Thank you so much for participating. We appreciate all of your input. And we'll move on to the next slide, Sophie. Okay, so we'll now pause here for some more time to see if anyone has any questions or comments, open up the floor for discussion. We'll pause for a second. So you can unmute yourself if you have any questions, or you can type your question in the Zoom chat.
Hi, my name is Melanie Taylor. Thank you for all the questions and the answers from the participants. And thank you, Rachel, for the introduction earlier today. It's a pleasure to be with you. My name is Dr. Taylor. I'm a physician, infectious disease physician. I actually work for the Indian Health Service here in Phoenix at the Phoenix Indian Medical Center. And I have a question for the participants related to whether or not you provide referral services for prenatal care to women who are pregnant or seeking to become pregnant. And the reason why, I'll give you one of the background to that question, is because we know that one of the greatest risk factors for congenital syphilis, or syphilis that passes from the mother to the infant during pregnancy or childbearing or delivery, is the fact that the mom did not have access to antenatal care, or when she went to antenatal care or prenatal care, she wasn't screened for syphilis. So maybe some of the urban Indian organizations and healthcare facilities, they may not offer STI services, but my question is specifically, do you offer prenatal care services or prenatal care referrals? And so thank you in advance for any responses. Maybe I'll take that as a no, that referral services for prenatal care are not provided, or for some. Okay.
We're also going to put Dr. Taylor's question in the chat. Oh, someone noted that they're new to the org and have yet to have a pregnant client come through. So great, thank you for that question, Dr. Taylor. That might be another thing to consider as we move forward, is to SDES and understand the level of referral capacity that some organizations have. So thank you for that question. That was a great question.
Sure.
Okay, well, is there any other questions or any comments that anyone would like to make before we move to our closing? Alrighty, okay, so we will move on. Next slide then, Sophie, thank you. Okay, so NCUIH has more events coming up, which you can see here, as well as a new on-demand community of learning series on person-centered care. The links to learn more about these will be shared in the chat. Thank you, Zoe. Next slide. We also want to remind you all again to please complete our survey to provide feedback on today's event. You can scan the QR code on the screen or visit the link in the chat to provide feedback. And you can enter a raffle to win a prize from NCUIH when you submit a survey. We also want to remind you to apply for our partnership opportunity, and please contact our team if you have any questions. And to also please keep an eye out for communications from NCUIH about our STI questionnaire and our training events. Again, thank you all so much for attending today's event. We hope you all have a good rest of your day. And with that, we will close it out. Thank you very much.